All right, guys. How's everyone doing? What's up, Todd? How are you?
Hi, Elliot. Thanks for having me.
Yeah, thanks. Thank you for coming on because I have some questions.
Yeah, I'm looking forward to it. Everyone's confused about this ordeal.
Yeah, it's just so hard, right? Because no, like the numbers don't like people. I don't know. Like you see such small numbers sometimes, and I think this really confuses people.
Right. I mean, there are a couple issues with the numbers, So first of all, as you and I've discussed, Elliot, you being a math major and all, the numbers are important. And if you talk about case fatality rate or who dies and who doesn't die, you have to know how many people are infected in total. We have absolutely no idea what that number is. We also don't really know the top number of the equation, the numerator, which is how many people have actually died of COVID, because we don't have adequate testing. So there could be people who have died of COVID, for example, in the intensive care unit, and we just thought it was like an influenza pneumonia. Or there could be people who never made it to the hospital. And, like if you look at the statistics out of New York, it's very interesting. If you compare the number of people that died at home last year this time compared to this year this time, there's a lot more people that died at home. And
This year or last year?
Yeah, this year.
Okay.
So maybe we can attribute some of that to coronavirus. That's what I mean. So I don't think the numbers are played out yet. And I think until we get really good testing, the numbers won't be really played out.
So what do you say to there's 50% of the people that are asymptomatic totally,
Yeah.
right? So how will we ever figure out that bottom number?
Yeah, it's really tough. You're right. So there are statistical analyses done, and they're done with artificial intelligence programs and whatever. And Harvard just did a study, their epidemiology department, which, talks about diseases in the world and how they're spread and how to avoid it and all that. So statistically, what they said is in order to encompass the majority of people where we can make decisions, we have to actually be testing between 500 and 700,000 people a day in the United States. So right now we're testing about 200,000. So we have to triple our testing in order to actually get good enough numbers to make judgments on that answer, who's dying, who's not, who's sick, and who isn't. And then we make guesses like that, right? 25 to 50% are asymptomatic.
What is it like with the flu, right? So those are guesses, right? Like when they say 16 or 30 million people have the flu every year, those aren't confirmed tests, right?
You're absolutely right. So the only way people really get tested in these kind of environments are if they contact healthcare, right? Like if you're a healthy guy like you and you get the flu and you call up your friend who's a doc and you say, hey, I got this, and the doc says, hey, you probably have the flu, stay home and don't contaminate everybody. You would never be tested, right? It just makes sense. It's flu season. You don't have other things going on. Maybe your kids just had the flu. It's that kind of thing. So it's only people that actually contact the healthcare environment. And even those people, when it's obvious that they have the flu, we don't test them.
You don't test them when it's obvious.
No. So if they come into the emergency department and it's the middle of flu season and they've got fevers, chills, aches, and pains, and 3 other people in their house, tested or one tested positive, whatever, we don't bother spending the money on testing.
So then how do they get that number of 0.1%, right? Because this is the number everyone's comparing it to right now, right? Because we know what the flu is, it's 0.1%. So how do we get 0.1% on the flu?
Because like I was using the Harvard study comparison before, we actually do have enough flu tests. Even though not everyone gets tested, we have captured enough of the population that we can make those estimates.
Got it. Okay. So we need more.
Sure, anyone who's sick, like in the intensive care unit and has flu-like symptoms, all those people get tested. So we have a really good handle on influenza.
Okay. So we need more testing is what it comes down to.
Yeah, absolutely. But I think it's important for everyone to realize that there's really 2 types of testing that are important. There's really in my mind, Elliot, there's like 4 things that you have to look at about this kind of disease process, right? So the first thing is, can you test for the disease up front? So that's called like an antigen test. And that's what we do with the flu. So you come in, we swab your nose or your mouth, and we send it to the lab, and we have that answer in a few minutes. And we know, do you have flu A, flu B, or not the flu? Okay. We can do the same thing with something called RSV. That's called respiratory syncytial virus. It's a common kid kind of thing. You can come in to the hospital and your kid's got a croupy cough and this and that, and we can be sure that it's RSV if we need to. Those are called antigen tests, and those are done up front when you're sick. The other type of tests are called antibody tests. And they are often called serology tests, and people confuse that. It's just a test from your blood as opposed to swabbing your nose and your mouth. And the blood tests take, we think, in coronavirus, about 10 to 14 days to have positive response. And what that response is you're having antibodies, which is part of your immune system. And your immune system this part is called your adaptive immune system. It adapts to different infections and recognizes them with memory. And then as soon as they get in your body, it blasts them. So we get immunity about 10 days to 2 weeks after we can measure that immunity. And we really need both types of tests for lots of reasons. We need to decide who can work and who should be quarantined. We need to decide who's actually immune and who isn't. We need to make decisions on the length of immunity. I mentioned RSV, a common kid virus. The same kid can get that 2 or 3 times in a year because the memory is terrible. It's just like your memory or mine. Certain things you remember all your life, you'll never forget. It's perfect. Other things, you can ask me something about last week and I'm not going to remember it. So the RSV virus, our immune system doesn't remember it well. Whereas like measles, it remembers it super well and you have lifelong immunity. And we have no idea where coronavirus is going to be in that kind of immunity picture.
So that's a big problem.
It's a big problem. And it's a big problem making a vaccine. People don't realize the easiest vaccines to make are ones that create great immune response. The ones that take the longest to make are ones that have the least immune response. So we don't know. So everyone says, oh, year and a half. To be honest, if a vaccine came out for this coronavirus in a year or a year and a half, it will absolutely 100% be the fastest vaccine production in the history of the world. So just so you know, that's unlikely.
But, okay. So let me ask a question about that though.
Yeah,
isn't every pharmaceutical company in the fucking world work like when has that has also never happened either, right? Because every single whoever hits this vaccine first is going to be a gazillionaire.
Yeah, there's something like 80. I counted them yesterday. 82 or 3 companies that are currently trying to test a vaccine across the world. That's absolutely right.
Right, because they're going to be rich, so rich.
Yeah, they're gonna hit it. But they might not hit it. What if it's like a kind of a mediocre vaccine like the flu vaccine, where some years it's like 50%, some years it's like 30%, some years, people get influenza A and then 2 months later get influenza B in the same, season. Those are different strains. So yeah, you're right. If they hit it, and if it's like a measles vaccine, and it's a lifelong deal, man, that's, I wish I knew who that company would be. But having said that, you still have to develop the vaccine. You have to test the vaccine in, non-humans, then humans. You have to figure out how long the vaccine confers immunity. Confers means, gives you immunity to the actual thing you're vaccinating. So that's why we get flu vaccines every year. And that's why we get one measles vaccine in our life, or one chickenpox vaccine.
Right. That makes sense. Yeah. And so it's all about the memory of what the body can do.
Yeah, it's just like the immune system's just like your memory, and this adaptive part of the immune system. And we just don't understand it well enough. No one knows why it remembers certain things really, really well and fights for you all your life. and why, in 2 weeks you can get RSV again as a kid, and why hardly any adults get RSV.
So so that leads to this thing that a lot of people saying, hey, I already had coronavirus because I was sick,
Right.
months ago.
Right.
And so that even could be true. And
that could be true.
That could be true. And then they could still get it again. We don't know.
Right. So usually when you have some sort of disease process and you have antibodies to that disease, it does make you immune to that disease. So, it's rare that people don't form antibodies and get some immunity. It's just that the how robust your immunity will be and how long you'll have immunity is absolutely unknown. What I mean by robust is, let's say you had a mild case or you're one of the asymptomatic people. Maybe you have kind of a bit of immunity to it, but you don't have enough immunity that if you get whacked with a big viral load, like you walk into a hospital and you get hit with a big viral load, you may actually develop that disease again. It may be not enough immunity. These are just things we don't know.
Because it's just such a new disease.
Yeah, 4 months, 5 months. And we know historically from other diseases, we just don't understand some of this very well.
So we have decided to shut down basically almost the whole world here.
Yeah.
Right? It's not just, it's weird. So I guess I kind of land on the side of either this is zeitgeist, right? Have you seen Zeitgeist on YouTube? Where there's 10 families that run the whole world and they're taking over right now.
Yeah.
Because it's not just America,
right?
It is a lot of the world, or this is for real. So how do we get out of this, man? Because it's hard for people to hear, right? It's hard for people to hear of, first of all, I think a lot of people don't understand what death rate means. They think it means their chances of dying, and that's not what death rate is, right?
Right.
Death rate is disease versus death,
Right. And I think it's important for people, Elliot, to break the fatality rate or death rate down into categories of who is at most risk. Because if you look at an overall fatality rate of, let's say, 2% or whatever, or 4% or whatever they say it is, we don't even know. So the number doesn't matter, right?
Right.
You also have to say, okay, of the 2% of people, what percentage of that is people over 70 with a medical problem? Well, let me tell you, it's a monstrous percentage of that 2%.
Right.
And then if I look at take the other end of the spectrum and look at all the kids that have gotten coronavirus, there's almost no reported deaths except in kids that have had other medical complications. So, conceptually shutting down everything, of course, you can't catch something from someone if no one is near each other. I guess that's a basic concept. But other countries have done a more sort of gradual thing. I guess my analogy would be we went into a room and just turned off the lights, right?
Right.
Other countries kind of had a dimmer switch and they kind of slowly dim the lights a bit. And as they're restarting, they're sort of turning the dimmer switch back on. So
you did. Let's be clear. You told me to close.
Yeah, but that is, I think, a little bit of a different situation because, here's the deal. Up front, when we were making that decision, and we made that decision early, probably before they shut down, most of the rest of the world.
Look, you told me so I was not on the I was like, man, we are not fucking closing, guys. I don't know what the fuck you're talking about. And then to appease one of my general managers, Ian, to appease him, I was like, look, I'm just going to call Todd, because this is my default.
Yeah, I got you.
And then I call you and you're like, yeah, you should. I was like, oh, fuck. I was like, God damn it. And we were the first to do it.
Yeah.
We were outside of a big city of New York. We were the first jiu-jitsu school to close down.
Right. But I also had a few clues, right? Because my involvement with the county stuff. So I've been on the phone with all these different people across the county and the country and stuff, trying to figure out the flow of this. Number one. Number two, jiu-jitsu is a close contact kind of situation, right? It's very different than maybe walking into a clothing store even, or maybe even getting your hair cut if you and the barber have a mask on, that kind of thing. So, jiu-jitsu is,
we're the antithesis of social distancing.
Yeah, absolutely. Right. I mean, so to me, it was kind of an obvious thing. If we were heading in that direction, it would be a shame for you guys to have some sort of pocket of infection at your jiu-jitsu academy that then, spread throughout Boulder, like what happened up in Eagle, Colorado. So some of my decision was around just getting ahead of it early and then making decisions as we go. The bottom line is we never opened it back up because things went downhill, not, they didn't improve.
Not uphill, not good, not in the good side, right?
Not good. So what I was really saying is exactly that with the dimmer switch. I would still take certain things and shut them down. For example, if you're age 70 and over, you should be at home, period. If you are at all ill, you should be home, period. Everyone else who's out in public could have a mask on and do good hand hygiene and those kinds of things. But unfortunately, in this world, you know how it is. I mean, I'm sure you've had jobs or gone to school. You just have to be there when you're sick and you just show up and you're exposing a bunch of people and it's not really what you want to do, but you don't have a choice. So we need to learn about wearing masks and we need to learn about social distancing. We need to learn about staying the hell away from others when we're sick. And then you could have had then an economy of a bunch of people like, you and others maybe who are healthy people working in the economy, helping to serve some of these people who you had to pull out of the economy, like the 70 and overs with medical problems, right? If you're on cancer chemotherapy, you should be at home. If you have an immune system that doesn't work, you should be at home. But everyone else could really kind of do what they did in Sweden and go about their business. You might catch it, you might not, but early on, we didn't know that kind of stuff.
Right. But you do think it's time now to start turning the dimmer up a touch.
Yeah, I do. I mean, I think, the economic side of my brain says that, people need to get back to things and need to work. And the scientific side of my brain says that we could be a lot more specific about who we keep at home. I use my sniper shotgun analogy, which I'm not supposed to use on TV.
Use it. Yeah, go ahead.
But this is to me, right? This is like going to shoot something, and you have a sawed-off shotgun, right? You're just spraying the whole area, and you're going to kill whatever you can kill, right? As opposed to a sniper who's looking through a scope and aiming very specifically at something. We should be more specific now about who we quarantine and who we don't to get the economy running again. That's what I think. Now, testing will really help with that.
Right. So I have some friends, right?
Yeah.
Like, for example, and like they're my good friends, but they don't wear masks.
Yeah.
How do we get people to wear masks? Because like they feel that that this is all a scare tactic.
Yeah.
Right.
Yeah.
Like, so, because look, I mean, I only wear a mask because like I got three people, right? Like I have you, I have Sovendal, and I have Renee, and you all tell me to wear the fucking mask. So who am I? Right. Like, yeah. If you start telling me how to teach a jiu-jitsu class, I'm going to start to disagree with you if I disagree with you. Right. But if the three of you easily are saying, hey man, just put a fucking mask on.
Yeah.
No, put a mask on.
That's what we should do. Yeah.
Why is this? Why do you feel like it's so hard for people? But it's so easy. Just put a fucking mask on.
So easy. I know. Look at other countries, Ellie. They've been doing this for decades, right?
Right.
Look at, traveling in Asia, right? Even when people aren't ill, they get on it's packed like, sardines, and there's no social distancing possible. And 95% of them have masks on, even when they're healthy. Right. So I think this is a weird thing in America. I think it's really going to change. I mean, I think people really need to wear masks. And it's probably maybe just during cold and flu season. Maybe for sure it is. If that person is sick, the contact person should definitely have a mask on. So I kind of feel like it's going to change things. And I think it should change things to some extent. Now, should you be doing jujitsu with masks on? That's a whole nother story, right? I mean, I think certain people and populations can be more at risk. You probably don't have a lot of 75-year-olds with heart and lung disease on the mat. So it's probably safe for your group of people, your cohort, to go about your business.
Right. But then we should still wear a mask outside.
Yeah.
Right. Because we don't know. Yeah. Right. Like,
I mean, during the event, I'm not advocating that everyone wears masks the rest of their lives outside.
Right.
I'm advocating that until we have a reasonable vaccine or a reasonable treatment or, something, because we've never done it for influenza. And it's probably a really good idea, because I guarantee this year we will have less influenza deaths in the United States.
Because we're all
social isolation, sure.
Right.
So think about it. So each year, maybe between 30 and 80,000 roughly people in the United States die of influenza, like you were saying. Well, I bet that's lower this year just because of the masks and social isolation that we're doing for the coronavirus.
Right.
So during cold and flu season, or if people are sick, or if you're visiting a nursing facility, or if you're going to be in a hospital setting, everyone should really have masks on. Do I think everyone, if you go to the gas station, you need a mask? If we have adequate treatments and vaccines, I think no. I think the big difference now is we don't have a treatment and we don't have a vaccine. And if someone elderly gets this, they're going to be in bad shape potentially.
So what about like on more of a macro scale of social gathering? Like, first schools. Yeah. Like public school.
I've heard all different things about public schools and when they are going to decide to go back. There's one chancellor of actually Purdue University who came out and basically said, we're definitely starting university again in the fall. The kids who go to this school have close to a 0% chance of dying from coronavirus. And, for the few kids that might have underlying medical diseases that makes them more susceptible or whatever, they can make their own decisions. So he's pushing forward based on what I just said. His populace is exceedingly low risk. I think every elementary school and, like the Boulder Valley School District and high schools and stuff, frankly, I think they should start up in the fall. I think once again,
but you do think they should be closed right now still and through the rest of the year?
Yeah, because I think that gives us a little time to get a handle on this disease. It gives us a little time because most of us are hoping it'll start to drop off like it has in China and, in Europe and everywhere else. Right. And it'll give us buy us some time to maybe test some additional treatments. There's many, many treatments being tested. We haven't talked much about that, but they're trying to figure out a treatment for this because obviously you can prevent the disease with a vaccine and that's great. But then for whoever gets it, you want to be able to treat it so they don't die. So they're working on that. So we're trying to buy a little bit of time and trying to get a little bit of handle on the immunology of this disease. And it's going to take some time. So yeah, I think they should start up in the fall. I'm fine with them stopping now. Although quite frankly, I think it's a very low risk for kids in like the Boulder Valley School District.
Right. So,
but it's about spreading it to their grandparents or their sick parents. So you got to watch the spread thing, right?
Right.
So if they went to school and then they socially isolated and wore masks everywhere out in public, that would be a reasonable way to deal with it.
Right. Makes sense because because the old people, right? Like
yeah.
You go give grandma a hug and there's a problem, possibly.
Right. And Ellie, a lot of people I think get confused. So I want to make one other quick point about this. Just because you have antibodies and you don't get sick. So let's say you were exposed to corona 2 months ago.
Right.
And I stuck you in a room with 10 corona patients. You don't get sick at all because you have great immune system now for that, right? It doesn't mean you're not carrying the virus and can't spread it still. Does that make sense?
That's a good point. Right. So you could.
Doesn't mean everyone. It doesn't mean it's not in your in your nose or mouth. It doesn't mean that you see what I'm saying? So you were just exposed. And just because you don't get sick doesn't mean you can't expose someone else. So we don't know that part of it either. So that's a little different part of the virus that we have to figure out.
Got you. What about like a lot of kids have asthma.
Yeah.
What about kids in asthma and corona?
It doesn't seem to be a problem right now.
Okay.
Sometimes kids with really bad asthma are on inhalers called steroid inhalers.
Right.
And steroids are a type of medicine that can lower your immune response. So there were some studies done early on. And this even had to do with adults. Should we take adults and kids off of their steroid inhalers during this sort of outbreak, pandemic? And the studies came out that probably the risk that they get, worse asthma or worse something else is much greater than any harm we're causing. So it doesn't appear to be, childhood asthma does not appear to be a big risk for this. Again, there's almost no kids that have died from this disease, except for some with really bad medical issues.
How about NSAIDs, right? Because that was a big thing as well in the beginning is take Tylenol instead of ibuprofen, things like that. So where are we at with the NSAIDs?
Yeah, that's still somewhat controversial, Elliot. Some people are saying no NSAIDs because it can make the course more prolonged or worse. Other people are saying it doesn't matter. If I got it, I probably wouldn't take NSAIDs. I'd probably take Tylenol for fever. That's really all you can do right now is treat the symptoms. So.
Right.
Yeah, so I would probably use something like Tylenol. If I was like shaking chills and it was just horrible, my bones were breaking, and I'd probably take an ibuprofen, here and there if that's what helps.
Right. Okay.
There's no good data either way.
And you talked a little bit a second ago. You said we haven't talked about treatment yet.
Yeah.
Right? So let's talk about treatment a little bit.
Yeah. Well, treatment's interesting, right? They're looking at a number of different ways to treat this virus. So first of all, they tried, which seems obvious, right? They tried the usual antivirals that we use for things like influenza, seasonal influenza, et cetera, and those didn't do anything. Then HIV is, we use medicines called antiretrovirals for those, and it's a type of antiviral. So they tried a couple different HIV type meds, because those were obvious choices because those meds are, FDA approved, they're safe, we know their safety profile, that kind of thing. But that didn't do anything either. And then there was people that got onto this whole hydroxychloroquine, plus or minus adding an antibiotic called Zithromax to it. And that was really crazy, actually. I know that was touted by the president and everyone for a while.
But we can just leave the politics out of it, right?
There's no politics here.
Right.
The studies were ridiculous. There was one French study that had about 30 patients in it, trying to see if this anti-malarial hydroxychloroquine would work. And they lost like 6 patients out of the study, which makes it statistically invalid. Those 6 patients either died or ended up in the intensive care unit from coronavirus. So the whole study was crappy, but someone just said, oh boy, we hydroxychloroquine, this is an old med again, it's been around forever. We use it for malaria, we use it for a couple rheumatologic immune things. So anyway, and then there was another study done by the Chinese actually showed that wasn't beneficial at all. And then there's been several other studies. So now the things that are more promising are the first thing, which is called a plasma treatment. So basically what this is, it's using immunoglobulins. It's using antibodies from people that have already formed antibodies to the coronavirus. So when someone's really sick, we can take blood from a blood draw from a patient who recovered from coronavirus. And then we select out the antibodies that they've made to the coronavirus. Then we can put that into a person who's really ill to get kind of a big whack attack, so to speak, on the coronavirus while that person's immune system is trying to catch up. So that's called a plasma or immunoglobulin treatment. That's being tested all over the world. There's a big thing going on in India with that. And we think right now that might be our best shot in the really sickest people in the intensive care unit. Then there are other medicines that are being tested, other antivirals. There's a company called Gilead Pharmaceutical. They're probably one of the leaders, but there's gazillions of companies that are trying to come up with treatments with either old meds or new meds. There is no treatment right now, period.
So you've used a couple of terms here, and I think, look, for the layman, it can be tough, right? Antibody, antiviral, and vaccine.
Yeah.
Right?
Let me explain that. Yeah.
Yeah. Explain them a touch.
Sure. Yeah. So before, when I was using the analogy of your memory, your memory and your immune system's memory, the way your immune system expresses that memory is with antibodies. So if you have a disease, your immune system is exposed to it and it recognizes the particular aspects of that disease, and it creates an army. And that army, they're like the Minutemen. They are ready to go. So if you ever see that disease again, if you ever see that disease again, then the army's there, they're geared up, they got their equipment, they recognize the enemy, and they attack. Okay. And it stops you from getting ill, okay? In order to create antibodies, to create this memory of your immune system, you can do it a couple of different ways. One way is you can give a vaccine. The vaccine is usually the virus, like in this case, it'll be as some part of the coronavirus. Usually it's the part of the virus that makes your immune system active. And what we have to do is figure that out, and then we can give you a vaccine, but the virus that gets injected can't replicate and cause you to be sick. So it gives your immune system an opportunity to create the army.
So the immune system creates the antibody. The vaccine says, "Hey, create the antibodies."
Yeah.
You don't need to have they don't take antibodies and then make a vaccine.
No.
Right. Okay.
No, that was a different treatment. What I was saying is we have it. So let me back up one step.
I think part of it was I was on my text thread with my friends, Yeah, and we were talking about this yesterday, and I was like, and what I said was, look, you're seeing that people who have had it, it comes back, and the antibodies aren't really mattering. And then they said, or one of them said, hey, that I guess we'll never have a vaccine then. And that is not the case, right? Because the vaccine and the antibodies it's not the antibody first and then the vaccine. It's the vaccine to the antibody is what you're saying. Or am I totally wrong?
Right. Okay. No, you got it right. But let me explain a little bit different.
Yeah.
If I say the word herd immunity, herd means everyone in the population, a herd. Okay.
Right.
Our goal is to have everybody immune to the coronavirus. So if it comes through, we can't get it again. Okay. Mm-hmm. The way to do that is to create antibodies. Okay. Your immune system is the creator of the antibodies. It's called the adaptive immune system. So that adapts to whatever is foreign in your body and creates antibodies. Okay. Then the way to get your immune system to react, there's really only two ways. One, you can actually catch the coronavirus, and your immune system reacts and makes antibodies, or you can get a vaccine so your immune system reacts and creates antibodies. But that's the only way to create herd immunity.
Got it.
Okay.
Yep.
But then the bigger question is, how long does that immunity last? That's when I was talking about the length of your memory and all that.
Right. Got it.
Okay. So those things are really in the category, Elliot, of preventative things, right? Because that will prevent you from getting the infection next time around, hopefully.
Okay.
The other category that I was talking about is the treatment category. And that's if you have coronavirus and you are sick, what do we do? Right now, we don't know what to do exactly.
Because there's no antiviral. Is that correct?
Bingo. Because there's no antiviral.
Antivirals deal with being sick right now and how we treat it now. Antibodies are what you build up, and the vaccine. I know what a vaccine is. I hope everyone knows what a vaccine is. Yeah. Right. Okay. So that was the big one that was confusing me was antibody and antiviral.
Yeah. So think antiviral is like against viruses. It attacks viruses. Okay. It attacks the coronavirus. And then the antibody is how you prevent from getting sick.
Got it. Makes sense.
Yeah.
All right. 3 more questions.
Yeah.
1, when do we have like sporting events again? Like when are we going to go to a Bronco game? When, a concert, stuff like that.
This is a huge question. I have a cousin who's out in San Francisco. He's in the sport promotion industry, and he's been asking me the whole, like every day, when are we going to, his whole world is gone now, right? He can't do anything. And what I've sort of gleaned from places around the country and hearing some, owners talking of different big sports teams and stuff, a lot of them are considering waiting until a vaccine is in place. Others are going to try and open up with social distancing in place, wearing masks. And frankly, I think that would be fine. If you're not ill and it's July here in Colorado and you want to go see the Rockies play and you're sitting, 6 or so feet away from people and you got masks on, I think it's 100% fine.
Okay. But back to normal, it's going to be a while.
It's going to be a while because I think these people that are counting on the vaccine, and you brought up the school districts before, I think there's some school districts counting on that too. I think they should open in the fall, but I bet there's other people who think, oh, we shouldn't open until there's actually a vaccine for this. I think that's pie in the sky right now. I think the vaccine is not going to. So they said like a year and a half. So January to January. So somewhere between January and June, they're telling people we should expect the vaccine. I think that's. I bet the farm that will not happen, because once we go through the steps of actually figuring out an adequate vaccine, like I said, we have to figure out how the vaccine works. How often do we have to give it? Every month, every year, every 10 years, like tetanus, who knows? And then the next piece is we have to produce enough to, how long it will take to produce vaccines to, make an immune response globally. I can't even fathom how long that'll take.
We have to go back to school in the fall, because I've already redone 4th grade and 1st grade. I don't want to redo 5th and 2nd. Right? Like, I'm fucking over this bullshit.
It's more interesting at 5th, Elliot.
Holy fuck, man!
That's where I stop.
This bullshit.
That's where I stop. 5th, baby. That's all it is.
All right, next question. I have a lot of jiu-jitsu listeners.
Yeah, sure.
When can we train again? When are jiu-jitsu schools gonna open? Does it matter if you are, like, for example, in New York City, right? Versus, Boulder, Colorado.
Yep. It totally matters. Yeah. Because what matters, Elliot, is this whole concept of reopening. And I use the dimmer switch analogy a bit. And how fast you turn the dimmer switch is really based on your case rate going down. So when Governor Polis is making decisions to reopen certain parts of certain things and not, et cetera, he's basing that on information that says we are having either plateauing or decreasing cases over about 2 weeks, okay? That implies that it's becoming safer and safer. Now, I guarantee you, once we stop the social distancing, there's going to be a rise in cases. But again, I think it should be done stepwise. And I think a bunch of people who are, training jiu-jitsu are probably not high-risk individuals, unless any of those individuals have, an underlying medical problem, which, and those people know who they are, people who have a compromised immune system, or maybe people who have an autoimmune disease. That's an interesting thing too. Like, autoimmune means that your immune system's memory is so screwed up that it attacks your own body instead of something else,
Right. Okay.
So that's just a good example of how poorly we understand the immune system. But people who have that tend to take drugs that suppress the immune system so it doesn't attack their body, and therefore makes them more susceptible to coronavirus and getting really sick. So I would say that for normal, healthy individuals in the age groups that come to the academies, I think it's going to be fine really soon. I think maybe by middle of May, something like that would probably be very reasonable, as long as we continue to have, less cases and less case fatalities and all that. But that brings up your point about New York. They'd never be ready by that time because there's too many cases.
Right. I mean, there's a guy in California who opened this week, because he was like, look, man, fuck you guys. He's in Northern California, right? He's like, we've had 30 cases in the whole county the whole time. Like, I'm not closing. Like
Yeah.
30 cases over 4 months, fuck off. Right.
It's
Like
not gonna
I
be-
don't need to be closed.
Yeah. I think that guy's right, Elliot.
Yeah.
I mean, I think, I really do. Like, you guys did the right thing, and I'm sure he closed up front too. Like, even
he did
didn't know that he wasn't going to be a pocket that went crazy there. So I think everyone did the right thing up front. But now I'm 100% sure it's time to start rolling. But like I said, strategically, sniper-like, with the dimmer, right? We need to go slowly, and we need to specifically say, yeah, you're good to go do whatever you want, but you're not good. You need to stay at home still.
And what happens with the reemergence? Like they're talking about this like second and third waves.
Yeah. Well, I think the first issue is to tell you I don't know if I buy that or not. So here's a couple examples. You heard of the SARS virus, right?
Right. Yeah.
Right. That was like 2002 or 3, if I remember correctly. You never heard of it again, have you?
No.
That's because it hasn't come around again. Have you heard of the MERS virus, the Mediterranean respiratory?
Yeah, I know what it is, but it was gone, right?
Right, gone. Had a huge fatality rate in the Middle East. It was something in the like high 70, 80% range, but it never really got anywhere. Those are 2 other types of coronaviruses. Yeah. Right. So those are the 2 other kind of deadly types. Then there's 6 other types that are just like common cold, So the coronavirus has a big family, right? And in the family, it's got like 3 deadly offspring, and it's got 6 that are pretty normal. And we don't know if this one will act like SARS and MERS and maybe not come back, or maybe come back every decade or every 3 years, or maybe it'll be like seasonal influenza and it's here to stay and it's going to be here every year. So that's when you're going to get a reemergence. But again, reemergence it's not so much about the reemergence. It's like, will we have stuff in place at that time? Will we have a vaccine? Will we have a treatment? Will it end up being just like influenza because we have vaccines and treatments?
Okay. Last question.
Yeah.
How do we get the public to listen to experts again? Because this is what it like it's really hard right now. Because like you hear overreaction, underreaction, like it's insanity sometimes, right? It's absolute like you have no clue who to listen to. Like I was saying, like I have good friends not wearing a mask because they're like, it's bullshit, right? Because they don't,
I know one of them.
You do know one of them, yeah. And so like. And we're not going to mention his name, but how do we get him to listen to you to wear a fucking mask? Like it's like, why, what is that?
Yeah.
And let's be clear. We both really like this person, right?
Oh,
like it's not, It's not like I don't like this person, right? Like he's my homie.
Joking. Yeah. No, he's a great dude. No, but I mean, he and I have had multiple conversations about this whole thing, as have you. And he's really on the sort of other end of the spectrum with this. More like it's not wrong, Elliot. Like you can look at certain countries like Sweden, for example, right?
Right.
Now, they would have made this individual wear a mask in Sweden, but Sweden left everything else open. Go do whatever you want at your own risk. But if you have medical problems, if you're over 70, if you're this, if you're that, you would be really dumb to go out in the public. But they didn't mandate anything. And they predicted.
Can I ask you a question about Sweden though, real fast? Their death rate is skyrocketing right now, though.
Right, but the problem, but they're going to reach herd immunity probably by May, which means that their death rate, assuming this really gives you immunity, herd immunity means like maybe the whole country. Now, again, Sweden's got probably as many people as Denver. I don't even know. Like we're talking about a unique situation here. But the point I'm trying to make as a model is they left everything open public-wise. Tons of people got it. And they think that everyone will have had it or very close by May 15 or May 30. That's the latest from Sweden. Then they don't have to worry about it again, theoretically, ever again. That's what they think. Now, that could be totally wrong because it could change. The virus could mutate. We call it genetic drift. These viruses do it all the time, and then you're up the creek. And
that would be a hard thing to do in a place like New York City.
Oh, yeah.
So like this argument of we could to do what Sweden did, like, could you do what Sweden? We couldn't do that, right?
No, that's the point I'm trying to make. Like,
Got it.
the
Okay.
only thing, so the concept, if you step back and you look at the 30,000 foot view, and the 30,000 foot view is, how do we decrease people dying from coronavirus? Okay. That's really the goal. That's the main thing here. So because we don't have enough tools, those tools being immunity to the virus, because it's a new virus, we don't have that. The other tool would be the vaccine we talked about. We don't have that. The other tool would be adequate treatment if you did get sick. The antiviral part, we don't have that. So if we had adequate tools, then basically this would be no difference than the seasonal influenza. But because we don't have those, we didn't really have a choice except to isolate people. You know, that's how else can you stop spread of a disease? You keep people apart. So we're really aggressive about this. What I'm hoping now is we don't ever have to shut down New York and all that again, at least for the coronavirus, because we can come up with some sort of vaccine, maybe the next couple years or something like that. And I hope a lot of people start to get it and start to develop immunity to it, because that would be great because less people would spread it.
I think that is a big thing that people have missed throughout this whole thing. The whole point of this was not that we don't eventually get it, like each individual. It was that we don't all get it right now, overrun the hospitals, and then people who shouldn't die.
That's exactly right.
Right. So
that's why you don't want it like on top of seasonal flu season, like a bad flu year plus a corona thing would be the whole place would go haywire. Yeah.
Right. And
but that's
New York almost did.
Sorry?
New York almost did.
Yeah.
Very close.
It did. Yeah.
Right.
Yeah. Basically, you know, but that's the principle behind the mask. All you're really doing with the mask is trying to decrease the pool of infectiousness, so to speak. So you can't get infected as easily, and you can't infect someone else as easily. Yeah. It's that simple. I can tell you, like, airlines are already instituting this. I think Southwest said, you know, everyone from now on is wearing masks. People who travel frequently, some of my patients and stuff who do a bunch of international travel, they've been wearing masks for years. Right. Just like all the Asian airlines and stuff.
I have friends that travel a ton and wear masks. Yeah.
Yeah. It's stupid not to, especially during cold and flu season.
Right.
I think it's an ego thing, Elliot.
I do too.
I think it's an ego thing.
I do too.
I look better in a mask, buddy, so I'm good.
I did hear a funny one though. I have a friend who's in Kentucky, and they're just opening, you know, and said, but you have to wear a mask, right? And the guy from the bank, the guy who runs the banks in Kentucky, was like, hey, look, we're gonna open, but no one can wear a mask coming in the fucking bank. And the governor tried to say, no, you have to make them. And the bank guy was like, no, man, no. Like we're going to figure this out, right? Mm-hmm. But you can't wear a mask walking in a bank. I think that's reasonable. No masks in the bank, and maybe like distancing and one person at a time, right? Like,
there are other ways to solve this.
There are other ways to solve this, but you cannot wear a fucking mask walking in a bank.
That's funny, right? Because my bank says no sunglasses, hat, or mask before you walk in the door.
Right, and it should be that way. That's cool.
Yeah.
So, all right. So basically, where we're at is it's time to turn the dimmer off a little bit.
Yep.
Right.
Brighten up the room. Start going back. Yep.
Start going back, man. And what's going to allow us to do even more and more is if we just wear a fucking mask.
Yeah.
Right?
Yeah.
Just wear a fucking mask.
Yep. Because that will ensure that the numbers keep staying down so we can open up more stuff. People can get back to work. I mean, I think like the thing we said about the mask, here's the big deal. Why do you wear a mask even if you know that you're not going to be the one that is going to die from this? It's exceedingly unlikely, right? The answer is A, so you don't spread it to people who could die from it, and B, so you can keep the total numbers in check so that we can get back to a normal life and, you know, go out to dinner and do all that stuff again.
Right.
The economy, people need to work.
Right. How do restaurants, one more, how do restaurants reopen, right? Because it's kind of tough. Like it's going to like, running a restaurant at 75% capacity is called a really shitty restaurant.
Yeah, no, I realize that. Yeah. That industry has really gotten hurt. I think that's a little more difficult because you're right. I mean, social distancing in a restaurant's not going to be super easy. Maybe they do it in a way where family or family members go together, or people who don't mind being at the same table because, I know you've been quarantining and I've been quarantining, whatever. We want to go out to dinner. We don't need our masks. We're at a table. We're 6 feet away from someone. It's going to be tough. I don't have a great answer.
I think they're tougher than jiu-jitsu, right? Because I mean, most of my clientele is very healthy.
Yeah, no, exactly. Restaurants, they're frequented by people, obviously, especially with like some of the fancier restaurants. So people with disposable income are usually older and more susceptible to this disease. They're going to have to come up with something.
Right. All right. Yeah. Thanks, Todd.
Oh, can I say one more thing, Elliot?
Of course. Yeah, please.
This is one of my favorite Corona moments, but where I live, there's a lot of people now been exercising and doing a bunch of stuff. So there's all these people like riding their bikes, and I'm on as you know, my street's a hill, and they're just whipping down this hill really super fast. But they have their masks on, their bandanas and stuff on. They're just forgetting to wear their helmets. So I want to tell all the cyclists that are whipping down my street at 90 miles an hour who are listening, the mask will save you less than the helmet.
Put the fucking helmet on.
Yeah, they got a mask on while they're cycling alone, and they don't have a helmet on.
My favorite one I have to say that I've seen so far is you're by yourself in your car with a mask and gloves on.
Yeah.
What are you doing?
We're still allowed to use common sense. It's just when you're with others.
But that's part of the fucking problem, man. Is like come on, you are riding at 40 miles an hour down a hill.
Yeah.
And you have a mask on, but not a helmet. Right. And you're in a car alone with a mask and gloves on.
Yeah, totally.
You can't catch Corona from your steering wheel.
No, your steering wheel won't cough at you.
Right.
I promise.
All right, man. I appreciate it, Todd.
Yeah, my pleasure. Anytime, Elliot.
All right, guys. That's it. Go out there, find your power.